Hello, friends. Today we are going to discuss, do you know why piles bleed? 75% of people experience hemorrhoids at some point in their life. Hemorrhoids are also called piles. I am Dr. Jagajit Singh Virk, MBBS, FCGP, FAMS, PGDGM, presenting to you this topic. This is a picture very much related to piles or hemorrhoids. It gives pain at the bottom. What are piles? Hemorrhoids, also called piles, are swollen veins in your anus and lower rectum, similar to varicose veins in your legs. Hemorrhoids can develop inside the rectum, that is called internal hemorrhoids, or under the skin around the anus outside, that is called external hemorrhoids. Nearly 3 out of 4 adults will have hemorrhoids from time to time. What are the main causes of piles? Piles are collections of tissues and veins that become inflamed and swollen. The size of piles can vary, and they are found inside or outside the anus. Piles occur due to chronic constipation or chronic diarrhea, lifting heavy weights in pregnancy or staining when passing a stool, being obese, having anal intercourse, or sitting long time on toilet seat. Can sitting causes piles? How sitting causes hemorrhoids? When you sit, the pressure on your buttocks makes the gluteal muscles spread out. In the process, the small veins around the anus and rectum are stretched and lose elasticity. Then the fragile veins become engorged with blood and you have hemorrhoids. How do piles look like? Piles usually look like small, round, discolored lumps. You might be able to feel them on your anus or hanging down from your anal canal. Your anal canal is the short muscular tube with blood vessels that connects your rectum back passage with your anus. This is the picture of your lower portion, part of your gastrointestinal tract. This is your large intestine. This is cecum. This is ascending colon. This is the transverse colon. This is the descending colon. This is the rectum, and this is the anal part, rectum and anal part. And when you see this rectum and anal part, this is exposed. This is the outer side, this is inside, and here it is internal pile. First degree. It is the first degree because it has not come out of the anus. When it comes out of the anus, then it becomes second degree or third degree, fourth degree. So this is the picture of internal piles. Symptoms, signs and symptoms. Hemorrhoids usually depend on the type of hemorrhoid. External hemorrhoids, these are under the skin around your anus. Signs and symptoms might include itching or irritation in your anal region. Pain or discomfort may be there, swelling around the anus, and there may be bleeding. Because when I show you the external, this is the part where the inside the skin here inside the skin, the veins will be engorged and gives you that appearance. Symptoms and signs of internal hemorrhoids. Internal hemorrhoids lie inside the rectum, as I had shown you. You usually can't see or feel them from outside, and they rarely cause discomfort, but straining or irritation when passing stools can cause painless bleeding during bowel movements. You might notice small amounts of bright red blood on your toilet tissue or in the toilet. A hemorrhoid to push through the anal opening, prolapsed or protruding hemorrhoid, resulting in pain and irritation. Signs and symptoms of thrombosed hemorrhoids. If blood pools in an external hemorrhoid and forms a clot, thrombus, it can result in severe pain, swelling, inflammation, a hard lump near your anus. Complications of hemorrhoids are rare but include anemia. Rarely, chronic blood loss from hemorrhoids may cause anemia, in which you don't have enough healthy red blood cells to carry oxygen to your cells. Strangulated hemorrhoids. If the blood supply to an internal hemorrhoid is cut off, the hemorrhoid may be strangulated, which can cause extreme pain. Blood clot. Occasionally, a clot can form in a hemorrhoid, thrombosed hemorrhoid. Although not dangerous, it can be extremely painful and sometimes need to be lanced and drained. What food cause piles? Foods with little fiber can cause or make constipation and therefore hemorrhoids worse. So it's best to limit how much you eat of them. White bread and bagels, milk, cheese, and other dairy, meat, processed foods such as frozen meals, and fast food. Which foods to be avoided in piles? While not necessarily low in fiber, spicy foods may increase pain and discomfort associated with hemorrhoids. Low fiber foods to avoid include dairy products. These include milk, cheese, and other varieties, white flour, red meat, processed meats, fried foods, salty foods. All these to be avoided. How long can piles last? There is no set duration for hemorrhoids. Small hemorrhoids may clear up without any treatment within a few days. Large external hemorrhoids may take longer to heal and can cause significant pain and discomfort. If hemorrhoids have not resolved within a few days, it is best to see a doctor for treatment. Do piles burst? Both external and internal hemorrhoids can become thrombosed hemorrhoids. This means that a blood clot forms inside the vein. Thrombosed hemorrhoids aren't dangerous, but they can cause severe pain and inflammation. If it becomes too full of blood, a hemorrhoid can burst. Can stress cause piles? The stress factor. Stress can lead to digestive problems, and straining due to constipation and diarrhea can cause hemorrhoid flare-ups. When people are stressed, they tighten their sphincter muscle and put pressure on the rectum. This pressure can cause hemorrhoid flare-ups. How long do piles bleed for? Bleeding from a burst hemorrhoid can last anywhere from a few seconds to several minutes. However, it shouldn't last for more than 10 minutes. In some cases, the area may continue to bleed occasionally between bowel movements. When should I worry about bleeding piles? If you have bleeding during bowel movements or you have hemorrhoids that don't improve after a week of home care, talk to your doctor. Don't assume rectal bleeding is due to hemorrhoids, especially if you have changes in bowel habits or if your stools change in color or consistency. Why does piles bleed? Straining or passing a particularly hard stool can damage the surface of a hemorrhoid, causing it to bleed. Blood from a hemorrhoid will look bright red on a piece of toilet paper. Internal, external, and thrombosed hemorrhoids can all bleed. In some cases, a thrombosed hemorrhoid can burst if it becomes too full. What is the quickest way to get rid of piles? Drink lots of fluid and eat plenty of fiber to keep your poo soft. Wipe your bottom with damp toilet paper. Take paracetamol if piles hurt. Take a warm bath to ease itching and pain. Use an ice pack wrapped in a towel to ease discomfort. Gently push a pile back inside if it has come out. Keep your bottom clean and dry. Exercise regularly. When to see a doctor? Anytime you have bleeding, feel a lump in the anus, or have rectal pain, you should see a doctor to make sure you don't have a more serious cause of the symptoms, because many other causes can give you bleed. Do hemorrhoids bleed every time you poop? Hemorrhoids are swollen blood vessels in the rectum or anus that can be painful, itchy, and sometimes bleed. People with hemorrhoids often have painless rectal bleeding. Bright red blood may coat the stool after a bowel movement, drip into the toilet, or stain toilet paper. Can there be lot of blood with piles? Bleeding attributed to internal hemorrhoids is usually bright red and can be quite brisk. It may be found on the toilet paper, dripping into the toilet bowl, or streaked on the stool itself. Not all patients with symptomatic internal hemorrhoids will have significant bleeding. Why won't my piles go away? If you have hemorrhoids that won't go away, see your doctor. They can recommend a variety of treatments ranging from diet and lifestyle changes to procedures. It's important you see your doctor if you are experiencing discomfort in your anal area or have bleeding during bowel movements. Can I remove a hemorrhoid myself? Hemorrhoids are typically easy to treat and clear up on their own. In very rare cases, a hemorrhoid can cause complications. Chronic blood loss from a hemorrhoid can cause anemia, a shortage of red blood cells. How do you poop with hemorrhoids? Because hemorrhoids are protruded blood vessels, more pressure causes them to swell up and become primed for tears or irritation as a stool passes over them. Try a step stool to elevate your feet while sitting on the toilet. This change in position of the rectum helps for easier passage of stools. Can I push a pile back in? Yes, you can push a hemorrhoid back in. In fact, pushing it back inside can protect the blood vessels and lower your risk of getting a blood clot or hemorrhoid strangulation. A strangulated hemorrhoid occurs when an internal hemorrhoid pushes outside the anus and gets trapped outside by the sphincter muscles. How should you sleep with hemorrhoids? You can try sleeping on your stomach, which can also take pressure off your anus and give you some relief. Lying on your back might put extra pressure on your anus and cause additional pain for hemorrhoids and sleeping. To prevent this, you can lay on your side with a pillow between your legs. What happened if you let a hemorrhoid go untreated? Though your hemorrhoids may retract back inside on their own or with a little help from you, prolapsed hemorrhoids tend to worsen over time. When left untreated, your internal prolapsed hemorrhoid may get trapped outside the anus and cause significant irritation, itching, bleeding, and pain. What size hemorrhoids need surgery? If someone has grade 3 or grade 4 hemorrhoids, doctors often recommend surgery. A general or local anesthetic is usually needed for this. You then have to stay in the hospital for a few days and stay off work for some time too. What is grade 4 piles? Grade 4 piles remains prolapsed outside of the anus. Grade 3 hemorrhoids are internal hemorrhoids which prolapse but do not go back inside the anus until the patient pushes them back in. Grade 4 hemorrhoids are prolapsed internal hemorrhoids which will not go back inside the anus in spite of your pushing back inside. These are the 4 grades, clinical grades of hemorrhoids. This is the first degree, no prolapse. It is inside, just prominent blood vessels only inside the rectum. This is second degree, bigger than this, emerges with strain but spontaneously reduces and returns. This is bigger than first degree. And this is third degree, prolapse emerges with strain and needs to be pushed back in. It has come out of the anus and it can be pushed inside and it will go. Fourth degree prolapse emerges and cannot be reduced or pushed in. This is bigger one. Once it comes out, it will never be pushed back into the anus again. This is again the same grades of piles. This is first degree, very small, and nothing is seen outside. This is second degree, and it is again very small, and this is third degree. It has come out this type, and this is fourth type. It will never go inside. These are again the same grades. This is first degree inside. This is second degree, a bigger one. This is external pile inside the skin. This is rectum. This is anus area. This is anal cushions here. This is third degree, which has come out and can be pushed back. And this is fourth degree. This one is fourth degree. It has come out. It will never go. It can't be pushed back. These are different grades of piles. Management of piles. Sitz bath with warm water and Epsom salt, magnesium sulfate. Wiping with the moist toilets rather than dry toilet paper. Sitting on ice packs wrapped in a towel can ease discomfort. Stay hydrated and ensure sufficient dietary fiber to help keep stools soft. Stay physically active to help reduce the chances of constipation. High fiber foods or fiber supplements like metamucil to make defecation easier. Over-the-counter pain medication like ibuprofen, suppositories or stool softeners can be used. Prevention. The best way to prevent piles is to keep your stools soft so they pass easily. To prevent piles and reduce symptoms of piles, follow it. Eat high fiber foods. Drink plenty of fluids. Consider fiber supplements like psyllium, methyl cellulose, etc. Don't strain when you sit for defecation. Go as soon as you feel the urge of defecation. Exercise regularly. Avoid long periods of sitting. This was all about the piles. Thank you very much.